Good morning, everyone. Welcome to New York City for those of you that are joining us from out of town today, and to the New York Academy of Medicine. The Academy was established in 1847 to address important issues in urban health and healthcare, and we have continued this work until now, working in New York City and in cities worldwide to advance urban health. Our current priorities are healthy aging, prevention, and eliminating health disparities. And we also sponsor the International Society for Urban Health, a unique global organization which brings together academics, program and policy leaders from the public and private sectors to advance the health of people in cities. So we are particularly delighted to host this meeting of the Institute of Medicine Forum on Public-Private Partnerships for Global Health and Safety for the next 2 days. My name is Jo Buford, and I'm president of the New York Academy, and with a co-chair of this forum with my colleague Clarion Johnson. Clarion, you want to wave so people, those who don't know you, know who you are. I want to give you a little bit of background on the forum before we begin. The forum was launched in the fall of 2013 and is reflective of the growing role of the private sector in contributing to diverse global health initiatives. The forum seeks to foster a collaborative community of multi-sectoral health and safety leaders from multinational companies, governments, foundations, humanitarian and professional organizations, academia, and civil society to leverage the strengths of varying sectors and multiple disciplines to yield benefits for global health and safety. We believe that powerful partnerships among these stakeholders are critical to fostering dialogue, exchanging knowledge, utilizing innovation and technological and process efficiencies, and expanding resources to advance humanitarian, international development, and global health interests. This is the third public workshop of the forum, and its important theme, the role of public-private partnerships in health system strengthening, is critical to achieving global health goals. We are excited about the diversity of the membership of the forum and thank the sponsors for their support and staff who make our work possible, especially Patrick Kelly and Rachel Taylor. And it's now my pleasure to introduce Simon Bland, who is director of the New York Liaison Office of UNAIDS and is co-chair of the workshop, to begin today's program. Simon?
Thank you, and good morning, everybody. It's a great pleasure to see you all here today. And what is a glorious morning in New York, and a great part of New York. It's funny, in Manhattan, you sort of, I tend to find you stick in your part of Manhattan. I'm Midtown. I very seldom get up here. It's beautiful. We should move. It's terrific. Let me just begin with a few thanks on behalf of Kate Bond of the FDA and myself as the co-chairs. Kate, unfortunately, can't be with us, but has put an awful lot of effort and work into the planning of this. But thanks to our committee of planners, Joe, who you've just heard from, Bob Bollinger, Bruce Compton, and Trevor Gunn. And thanks to the staff under Patrick's leadership, Rachel and Priyanka, and to Kimberly, who has since left, who has really, I think helped us on a great process of planning this event today. I want to acknowledge and welcome a number of people who will be watching this, listening to this on webcast. You've seen the program. What we hope in the program is there will be plenty of time for discussion, plenty of times for questions and answers throughout the agenda. For members and those sitting on the table, usual convention, please just raise your tent flags for us to see who needs to speak. For others, I think there's going to be mics for people to speak. I'm very excited about this meeting and this subject. And doing it here in New York and doing it at this time. One of the great things about this forum for me is that it brings people from very different walks of life together. It brings people from the private sector and the corporate world. It brings academia. It brings non-profits. It brings government agencies, the UN, NGOs, all together to talk about crucial issues of importance to global, national, and local health. For the last 2 years, I've worked for the UN, and I spend quite a lot of my time down at First Avenue down there. And you can come out of a meeting and people say, so how did that meeting go? And you say, oh, it went pretty good. And then I crossed First Avenue and re-entered the real world, and came out of that bubble that is the UN. This forum is a great bubble buster for me. I love it. It's really excellent to come and hear these different perspectives. I think we have a terrific lineup of panels and speakers for you. I think it's a great opportunity for us to learn from one another. I hope that we can think practically, pragmatically, and be forward-looking in identifying solutions, ideas, and recommendations. So why now, why here, and why this? Well, first of all, why this? The forum brought out a number of ideas and issues that it could look at this year through a process of electronic voting, health systems, and a public health practice. So it's something we determined ourselves as an important and timely issue. I do beg your pardon. Okay, I'm not going to start again. I hope that's my voice should be loud enough. Everyone hopefully will have heard. But I'm sorry for those listening in if they didn't. So we self-selected this as an important topic for us at this time. But as we rapidly close in on the deadline of the MDGs over the last 15 years, it's a really important time to reflect on where we are and where we're going. Now, you can say what you like about those MDGs. You can love them. You can hate them. They've certainly helped mobilize resources. They've certainly helped prioritize and channel many of those resources. They've built political pressure and momentum, and they've helped measure and track progress. They've established a blueprint for tackling some of the most pressing challenges of our time. They've made a profound difference to the lives of many, many people. Global poverty was halved 5 years ahead of schedule. 9 out of 10 children enroll in primary school with as many girls as boys in school. Remarkable gains have been made in the fights against malaria, tuberculosis, and HIV and AIDS. And the likelihood of a child dying before the age of 5 has been nearly cut in half. And the target of halving the proportion of people who lack access to water has also been met. It created a political agenda behind which people have mobilized and rallied, and many have held governments more closely to account than ever before. Official development assistance, global aid, reached record levels in both 2013 and 2014, reaching $135 million. But the MDGs paid little attention to the private sector. They paid little attention to economics and economic growth, let alone sustainable economic growth. They didn't pay enough attention to institutions, and institutions really matter. And they had a limited number, which was a real benefit at one level, but also a bit of a drawback at another level. During that period of 15 years, global health, in many respects, did reasonably well. Development assistance to health grew rapidly from 2000 to 2010, over 10%, 11.3%, I think, year on year. In 2014, $36 billion of development assistance to health, around 26% of that overall ODA package. So health really did get quite a lot of prominence in that period. Remember, we had 3 goals out of 8 goals in that period with a real focus on health. We saw new institutions and partnerships being developed. We saw the evolution of Gavi, the creation of the Global Fund, UNITAID, the drug purchasing facility. A so-called new generation of 21st century institutions, of which the public-private partnership was a key, an almost new dimension and a way of thinking about the future. Many of these are very issues-based and vertical in nature. I guess the organization I work for now was the first creation of something that was so specific in health to tackling HIV and AIDS. It's quite a unique model as it brings different parts of the UN together, but really creating an institution to focus on a single issue. And so we've had these vertical programs that have clearly mobilized vast sums of money. There's an increasing awareness, though, I think, that verticality and that single issue approach is perhaps not the most sustainable and appropriate model going forward, and there are lessons to be learned. We also saw, I think, over the last 15 years, an incredible proliferation, and go figure, money stimulates all sorts of activities and behaviors, but this proliferation of institutions dealing on issues of global health A recent paper I read as we were doing a Chatham House piece on global architecture suggested 203 global health institutions. So now we negotiate the Sustainable Development Goals. We negotiate the financing for those goals. This is not MDG 2.0. It is different. It is intended to be different. It is universal. It should be transformational. It should be highly ambitious. It should combine social, economic, and environmental pillars of social development. That all sounds great, but that's not going to be easy, and there are many challenges embedded within that. Health in the MDGs was 3 out of 8. Health in the SDGs is 1 out of 17. Are we worried about that? Are we particularly concerned about that? I'd suggest we don't need to be, frankly. There is a reasonably well-articulated goal, ensuring healthy lives and promote well-being for all at all ages. There's a little bit of a redundancy in a short sentence already, which illustrates sometimes what drafting by committee in the UN can do. But it's not a bad goal, and we have 9 targets covering maternal health, child health, communicable diseases, non-communicable diseases, not there in the MDGs, substance abuse, road traffic safety, sexual reproductive health services, universal health coverage, hazardous chemicals, air, water, and soil pollution. So, a broad range, and within those, a whole range of targets and indicators that will cascade from that. And a number of means of implementation important for that around the Framework Convention on Tobacco Control, access to medicines, research and development, and TRIPS flexibilities, health financing, the health workforce, management of global health risks. So I think we have to argue that none of those are going to be achievable without much stronger health systems. Strong ownership and country leadership is a deep imperative for a robust, resilient, and sustainable health system. We're not going to achieve any of the ambition of those goals without not only a recognition of the importance of intersectorality, which many people talk to, but the mechanisms of actually operationalizing that at national and subnational levels. A deep recognition of the determinants and drivers, the behaviors. Some of the reflections from the meeting we had yesterday thinking about the prevention of some of the chronic illnesses and non-communicable illnesses are going to be a much larger feature, I think, of the agenda going forward. We need multi-stakeholder approaches, the importance of the community and inclusive development. And without the private sector, and without public, private, and NGO sectors learning to work ever more closely together and effectively together, we will not achieve the ambition. Also, none of this ambition is going to be achieved without ambitious financing. The ambition in financing will come from growth, it will come from efficiencies, and it will come from reallocation. And I don't mean reallocation between communicable and non-communicable diseases, or indeed between health and education. If we get into those old zero-sum gain arguments in the development sphere, I think we're missing the bigger point about a transformative world. The private sector is playing a big role, but that role needs better definition and understanding. A role that understands that the SDGs are good for business, but business is really good for the SDGs, and I don't think we're there yet. A better understanding and more focus on public-private partnerships where the values are understood and shared, where trust is built and sustained, and where market failures and gaps and weaknesses are identified and incentives are put in place to fix them in the interest of the poor and those that get left behind. We have a real opportunity, I think, this year. The MDGs saw progress, but the gains are fragile, unfinished, and reversible in many respects. We have to be smarter today than we were 15 years ago. We have new technologies, we have new innovations, we have new connectivity. Innovations come from everywhere. We've talked historically about north-south development. We've increasingly talked about south-south development, and we see increasing exchanges and ideas of technology transfer and capacity building. We will increasingly talk about south-north. We have a lot to learn from elsewhere. The Ebola outbreak in West Africa and the health security has created a moment where health systems are more in focus than I think at any time over the last, certainly 5 years or so, perhaps over the last 15 years. There are many lessons still to learn from that at the global and at the national level. The various commissions, and there are several, will help us think that through, and action will need to be taken at all levels. But if we get this right, we can see how over the past, certainly in the AIDS response as an illustrative example of this, from millions to billions. We were talking about raising millions of dollars. We needed to up it to raise billions of dollars. We raised billions of dollars. $19–20 billion or so goes into the AIDS response every year. We now need to talk about from billions to trillions. From billions of official development assistance to trillions of dollars from all sources that are better channeled towards the interests of the many rather than just those of the few. And I think billions to trillions, and it's a report that was written by the World Bank, the IMF, and regional development banks, is shorthand for a realization that achieving the SDGs will require more than money. It needs a global change in mindsets, approaches, and accountabilities to reflect and transform a new reality of a developing world with highly varied country contexts. And I would argue that public-private partnerships in the health sphere and public-private partnerships specifically thinking about how one builds, sustains a resilient and robust health system is a huge part of getting that agenda right. So with that, I welcome you all. I look forward to the next 2 days. We've got great speakers. I'm now going to, I think, hand over to Bob to introduce our first speaker. Thank you very much.